I want to thank my colleagues who've spoken on this amendment, particularly those who oppose the amendment. Mr. President, I come to the floor today with sadness in my heart. I come because yesterday or over the weekend, one of our Maryland National Guard was killed in Afghanistan. He was one of two men working in a building in which he was attacked by someone he trusted at the Interior Service, and it appears that he was assassinated. I talked to his widow. We're sad. We're sad that somebody who went to defend freedom was killed in such a terrible way. I'm sad because last night I spoke to a dear friend of mine whose husband is very ill from the ravages of brain cancer. And we remembered so many good times we had together, but those good times now don't seem possible in the future. And I want so much that she be with her husband and not think about the consequences of cost and so on. And today, or last night, we learned that our very dear friend and colleague, Senator Olympia Snowe, is going to retire not because she's tired, but because she's sick and tired of the partisanship. Senator Snowe is not tired. She's sick and tired of the partisanship. And you know what? So am I. We have a highway bill here. We have an unemployment problem. We could solve America's problems and get it rolling again. And if we pass the highway bill with the appropriate debate on amendments germane to the bill, we could do it. So I'm really sad. I am sad that I have to come to the floor to debate an amendment that has no relevance to the highway bill. And I'm sad because we are so tied up in partisan politics and scoring political points that we don't look at how can we get our troops out of Afghanistan? How can we make sure we have a budget that can fund the cure for cancer and at the same time make sure any family hit by that dreaded C word doesn't go bankrupt during care? And I'm devastated that a dear friend and an extraordinary public servant is so fed up with how toxic we've become that she chooses not to run for office again. So I'm going to be serious. And therefore, you need to know I'm really sad about this. But I'm also really very frustrated about this. So I'm going to talk about this blunt amendment because we've heard nothing but mythology, smoke screens, and politics as masquerading as morality all day long. So let me tell you what the blunt amendment is not. It is not about religious organizations providing health care and government saying what the benefits should be. It is not about affiliated religious organizations and government saying what the service is to be. This amendment is about non-religious insurance companies and non-religious employers. It is about secular insurance companies, and it's about secular employers. The blunt amendment allows that any health insurer or employer can deny coverage for any health service that they choose based on something called religious beliefs and moral convictions. Now, there's a body of knowledge that defines religious beliefs, but what is a moral conviction? That's not doctrine. That's your personal opinion. A moral conviction, no matter how heartfelt, no matter how sincere, no matter funded upon ethical principles, is still your personal opinion. So we're going to allow the personal opinions of insurance companies and the personal opinions of employers to determine what health care you get. What happened to doctors? What happened to the definition of essential health care? So this is not about religious freedom. This is not about religious liberty because it's not even about religious institutions. So let's get real clear on this blunt amendment. This amendment is politics masquerading as morality. And make no mistake, the politics is rooted in wanting to derail and dismember the Affordable Care Act and our Preventive Health Care Amendment. So what the Blunt Amendment does, as I said, allow any insurer or any employer to deny coverage based on religious beliefs or moral convictions. Well, what that essentially means is this. Let's look at examples. If an employer has a conviction, a personal opinion against smoking, they can refuse to cover treatment for lung cancer or emphysema. If an employer has a personal opinion that he calls a moral conviction that doesn't approve of drinking alcohol, they can refuse to cover any program for alcohol treatment or substance abuse. Let's say that there's an employer who doesn't believe in divorce and says, I won't cover health care in my bill for anybody who is divorced because I think I have a moral conviction against that. Okay? Suppose you say, in some schools of thought that says, I have a moral conviction that says a woman can only see a woman doctor, and I won't cover anything where she's seen by a male physician. Well, where are we heading here? I mean, I could take this down. These are not ridiculous examples. It puts the personal opinion of employers and insurers over the practice of medicine. This is outrageous. This is vague. It's going to end up with all kinds of lawsuits. And, let's speak about lawsuits. So while we've all been pounding, some have been pounding their chest and talking about religious freedom in the Constitution, what's also in the Blunt Amendment is this whole thing that gives employers access to federal courts under the Blunt Amendment if they feel they can't exercise that amendment. This is a new lawyers' full employment bill. I'm shocked because the other party over there is always trashing lawyers. They're always trashing the Trial Lawyers Association. And now they've created a whole new right or an opportunity for federal court action, clogging the courts on this particular issue. You see, this is why America's so fed up. They want us to be focusing on health care. They want us to be focusing on how to lead better lives. And so let me talk about how we got to this in the first place. You remember why we had health reform legislation? I remember, because it still exists. 42 million Americans are uninsured. 42 million Americans are uninsured with health care. This is the 5th anniversary of a little boy in Prince George's County who died because he did not have access to dental care. His infection was so bad, so severe, there was nobody to see him. His mother was too poor to be able to pay for it. That little boy, in the shadow of the capital of the United States, to die. Now, that's why we worked for the Affordable Care Act. And you can call it Obamacare. I don't care what you call it. I call it an opportunity for the American people to get what a great democratic society should provide. And then we also not only looked at what was uninsured, we also looked at the issues around women. Senator Stabenow and I held a hearing. And guess what we found? Women paid more for their health insurance than men did of equal age and equal health status. Nobody said, wow, that's a social justice issue. Well, I have a moral conviction about that. I have a really deeply felt moral conviction that if you're a woman, you shouldn't be discriminated against by your insurance company. We also found that women were denied health care because of pre-existing conditions. We found that in 8 states, that if you were a victim of domestic violence, you were doubly abused, not only by your spouse, but you couldn't get insurance coverage because they said the cost of physical and mental health care would be too much. Well, I had a moral conviction. I had a moral conviction that if you're a victim of domestic violence, you shouldn't be denied health care. I had a real strong moral conviction about that. Then, during my hearing, I heard a bone-chilling story. It wasn't just me, those who were attended. There was a woman who testified that she had a medically mandated C-section. Then she was told by her insurance company in writing that she had to get sterilized in order to receive health insurance from them. The insurance company was mandating sterilization to get coverage. I nearly went off my chair. Now, at that hearing, there was a representative of the insurance company. They had no moral reaction to that. They had no moral reaction to that. I had a reaction. I had a really big one. That's why we offered the amendments that we did, where you could not deny health care on the basis of pre-existing conditions. So I have a lot of moral convictions around this, that in the United States of America, no child should die because of the absence of health care. No woman should be discriminated against in the health care system. And at the same time, that you need to be able to have the opportunity to get the services that your doctor says that you needed. But the other thing is, I wanted not only to save lives, but to save money. And we knew that prevention was the way to go. And I came to the floor and offered the Preventive Health Amendment. And it was a great day. Men and women spoke for it. And it was primarily oriented to women, but it was going to cover men as well. And it was going to make sure that early detection and early screening would save lives. We spoke about the necessity for mammograms. We spoke about the necessity for screening for diabetes and heart disease. And the kinds of things that, if detected early, could save those lives. That bipartisan amendment passed. Then, after it was passed and the bill passed, the Secretary of Health and Human Services said preventive benefits should be defined not by politicians and not by a bureaucrat at HHS, but by the medical community. So she requested the Institute of Medicine to define the preventive health care benefit. The preventive benefits that we're talking about, that Blunt says an employer doesn't have to provide, came from the Institute of Medicine. It didn't come from the Congress. It didn't come from bureaucracy at HHS. It came from a learned, prestigious society that we turn to, the Institute of Medicine. These are what they said were the essential preventive services that would save lives and also save money. So this is where this came from. Now we're on the floor saying if you have a moral conviction against what the Institute of Medicine says is the essential benefit, you can go ahead and do it. And again, we're not talking about religious institutions who are employers. We're not talking about religious affiliated institutions. We're talking about non-religious institutions. Madam President, ordinarily I would call this amendment folly, but this is really a masquerade. And I think it's just one more excuse to opt out of the Affordable Care Act. It's one more excuse to opt out of Obamacare. And I don't think it's an opt-out. I think it's a cop-out. And we have to stop masquerading that this is about morality or the First Amendment or someone's religious beliefs. So, Madam President, I hope we defeat this Blunt amendment. And most of all, I wish we would get back talking about the serious issues affecting the American people. I'm going to bring those troops home. I sure am going to find that cure for cancer and help we come up with the resources that we can do it. I'm going to be sure that no little boy ever goes through what DeMonte Driver and his family had to suffer even to the end. So, Madam President, let's defeat the Blunt Amendment. Let's get back to the highway bill. Let's get America rolling. And how about let's start functioning in an institution that focuses on civility and finding that sensible center that America is known for in other years that we had our ability to govern. I yield the floor.